Workers in many occupations are at potential risk of exposure to bloodborne pathogens, or BBPs. The Occupational Safety and Health Administration, also known as OSHA, and the California Division of Occupational Safety and Health, commonly referred to as Cal-OSHA, require that employers take certain steps to protect their employees from being exposed to BBPs, including providing appropriate protective equipment, as well as providing initial BBP training and annual refresher training. While your employer should have a plan that meets the requirements of these bloodborne pathogen standards, OSHA provides several resources you can use to educate yourself. Visit www.osha.gov for more information. Follow the link on your screen for a copy of the Bloodborne Pathogens Standard. When you have successfully completed this course, you should be able to recognize the characteristics of bloodborne diseases and their possible routes of transmission. You should also be able to identify the methods of exposure control and safe work practices for handling, cleaning, and decontamination. Finally, you should be able to recognize exposure protocols and record-keeping requirements. Lesson 1. Characteristics of bloodborne disease. Pathogens are any microorganisms, such as bacteria or viruses, that cause disease in humans. Bloodborne pathogens are pathogens that are present in blood or other potentially infectious materials. Under the Cal-OSHA standard, the term blood means human blood, components of human blood, and any medications or other products made from human blood. Other potentially infectious materials, sometimes referred to as OPIM, include certain body fluids such as semen, vaginal secretions, and amniotic fluid, and any unfixed human tissues or organs other than intact skin. OPIM also includes any body fluid that might be mixed with blood. Bedbug droppings may be considered OPIM. Urine, feces, sweat, tears, and saliva are not considered OPIM unless they are visibly contaminated with blood or there is reason to believe blood might be present, such as in saliva during a dental procedure. The Cal-OSHA standard focuses on preventing exposure to the 3 bloodborne viruses that pose the highest risk to U.S. workers: the human immunodeficiency virus, or HIV, the hepatitis B virus, or HBV, and the hepatitis C virus, or HCV. HIV attacks the immune system. It usually causes mild or no symptoms at first, but it makes people susceptible to other diseases and can lead to acquired immunodeficiency syndrome, or AIDS. HBV and HCV cause liver inflammation and can lead to serious forms of chronic liver disease. Symptoms for both types of hepatitis are similar and include fatigue, nausea, abdominal pain, and jaundice. Jaundice is a yellowing of the skin and eyes caused by poor liver function. All 3 viruses can eventually result in death. Click the links on your screen to download more information about HIV, HBV, and HCV. There are other bloodborne pathogens, including syphilis, malaria, Creutzfeldt-Jakob disease, and the Ebola virus, but all are considered rare in the U.S. and are generally only a concern for certain healthcare and mortuary workers. Cal-OSHA requires your employer to provide you with BBP training and safety measures if you have what is called occupational exposure. Occupational exposure means that it is reasonable to anticipate that you could come into contact with blood or OPIM while performing your normal job duties. Common examples of jobs that may be associated with occupational exposure include healthcare providers, anyone who is expected to provide first aid, tattoo artists, anyone expected to clean up blood or dispose of contaminated trash, and anyone expected to handle large quantities of trash or laundry that could contain contaminated items. If any employees at your facility have occupational exposure, Cal-OSHA requires your employer to develop an exposure control plan, or ECP. This is a document that describes who is occupationally exposed and the protective measures the facility has developed to protect them. A copy of the ECP should be located where employees can easily access it. It is your employer's responsibility to determine what hazards exist in the workplace and to take all necessary precautions to protect workers. Ultimately, however, it is both your right and your responsibility to protect yourself on the job. Your employer should provide you with protective equipment, but it is your responsibility to wear it. Make sure to familiarize yourself with your facility's ECP and tell your supervisor right away if you feel you need additional training, equipment, or procedures to protect yourself.